Hello, welcome back to Sport Muftivation podcast. Hello for the sport enthusiasts. So we are now we're gonna talking about the different background, different cases, because here's Fatima, Kiran Fatima from Pakistan.
Hello everyone, Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh. How is everything, Fatima?
Alhamdulillah, everything is fine.
Alhamdulillah. So, how's your life so far in Korea?
It's full of ups and downs, but I'm like enjoying it. 괜찮아요?
진짜? Okay, so this is Fatima. She was a doctor and especially psychotherapist, right? Physiotherapist. So we're gonna talking about her background, which is related with the sport. So before we talk about the physical therapist things, I wanna ask that how you grow up,
Okay, so I was born and raised in Islamabad, the capital city of Pakistan. I attended my schooling from the City School CCI campus, one of the biggest international schools in Pakistan. And after completing my O levels, I did my FSC. And after that, I opted for DPT, Doctor of Physical Therapy, which is a 5 years program for being a physiotherapist. So yeah.
Oh, 5 years program?
Yeah. And after from Shifa University in Islamabad, after that you do 1 year or 6 months of house job in any of your selected hospitals in any of the cities.
Okay, so you switch your, I think, career from the doctor to the, I think it's still related, but doctor to the psychotherapist, right?
From doctor to physical therapist. The thing is, our degree is called Doctor of Physical Therapy. So so
okay.
it's like doctor. We are in many other countries you're not allowed to put doctor in your name, but in Pakistan we are allowed to do that. So it's like Doctor of Physical Therapist. So I am allowed to put doctor with my name as well.
Okay, so basically you are interested with the doctor things. Why you love as a doctor?
Growing up, my parents always wanted me to be a doctor. Especially when you're that side of the Asian part, your parents always want you to be in some well-respected career, and especially being a doctor is something prestigious in our country. So obviously, every parent wants their child to become a doctor, and my parents always told me you are going to grow up and you're going to be a doctor, and somewhere that became my dream as well, to be a doctor. So I did my pre-medical FSC in pre-medical with science and everything, but unfortunately the system in Pakistan is really competitive when it comes to becoming going for the exam, taking the exams and things like that. So I was not able to do the exam very well.
Okay.
Then I had 2 other chances. I wanted to take them. I was asking my mama, can I just retake the exams twice? She's like, no, there's another field. She actually told me about Doctor of Physical Therapist. Surprisingly, she had more idea about it than me, because my elder siblings had cerebral palsy. So she since they were young, she used to take them to physiotherapists. So she had quite better know-how of this field, and she kind of saw this field grow in Pakistan as well. So she's like, why not go for this? Why waste your 1 year or 2 year and retake the exams? Why not just go for this? So yeah, I opted for that, and rest is history.
So do you think that you found true love with this kind of professions?
Yeah, I think being a physiotherapist, helping people with disabilities, especially children with cerebral palsy, is something I really, really enjoy and love. The time I worked in a government hospital as a physiotherapist, it was very hectic, but because I loved my occupation, it was nothing for me. I could just stand there from 8 a.m. till 2 p.m. doing my job, doing the rounds, going to the different hospital like sections like surgical wards and this ward and that ward, and taking care of the patients, coming back to the department, taking care of the patients in the gym and things like that. Yeah, I really enjoyed that. It was hectic, but I enjoyed it a lot.
How hectic you feel at that time?
Maybe not that hectic because I was enjoying it a lot, but when you think about it, when you look back at it, like you were on your feet from 8 a.m. till 2 p.m.
Okay.
and you were treating so many patients that you don't even like know how many patients you had dealt with, like over 50 patients in a day, and going from ward to ward and department to department. It was like quite hectic, but like when you love your job, nothing else matters.
Okay, so you're passionate with this job, right?
Yeah, especially when you're treating the geriatric patients, like old patients, and they come and give you like so many blessings and duas, and you're like so blessed. They bless you like, thank you for treating us and this and that, and I feel better, and and when you see the improvement in your patients as well, you feel like you have done your job, like totally done your job.
Wow, such a good inspirational story from Fatima, because I think as a doctor, because friends of mine, there are many doctors, and then they were like work hard like every single day, like beside their works as the doctor, they should to learn something, they should to find the article, the literature, and then continue their study and everything. It took time very much. So do you think how can you stay in love with this job?
I think being a doctor is something like you can never end learning in that profession. It's always like there's some new case, some new disease, some new thing that is coming up, and you have to go through the literature review and a lot of books and revise and everything. But once you are practicing everything, and once you are like okay with what your knowledge is, when you have a strong grasp of everything, like it's easier. It's okay. You kind of, and especially when you're treating patients and you are seeing the improvement in your patients, like it's the biggest satisfaction that you can ever get in your life.
Wow, great. So next question is, let's talk about the sport related topic. I'm gonna ask about what's your strong why, the strong reason to join in the sport world?
Okay, so as when I was in my school, like since like very young age, like in grade 5 or something, we used to have this big playground, and we used to play all kind of sports. Like we had this big basketball court, and then volleyball, table tennis, and things like that. We used to enjoy that. We used to have PE, physical education class, and then we used to play a lot of like sports in there. And especially I enjoyed playing basketball with my friends. And at that time I was like good at it. I used to play a lot, but in Pakistan not many parents encourage you to pursue your sports like side of the thing. So I was never encouraged or never led by my parents to explore that side. In Pakistan the priority is always your education. You always go for good education, you focus on that. Sports is something that you enjoy during your PE, like only the physical education period that you have, that's it, no more. So then after I did my O-levels and I changed, like I went to my college, I kind of lost all the sports side of mine and focused just solely on my education. Then while I was doing the undergraduate, like we had sports physiotherapy as well. We had this topic, and we kind of learned about sports and how physical therapy like helps sports as well. So I kind of we had like this sports, I used to enjoy this and that, and I used to have fun and things like that. And then when I became a physiotherapist and I started working in the government hospitals, in government hospitals you have like a lot of different kinds of patients. It's not just one restricted, like one certain kind of patients, but a lot of patients from a lot of different areas and countries and areas and diseases and things like that. So I used to have different athletes there as well come in who were like local athletes or things like that and the different injuries, and we used to talk and they used to tell me like what are the challenges they are facing being an athlete in the local level or government level or whatever they were playing the games for, and they used to tell me, and it kind of like provoke my interest in sports more, like this is happening, and I think like sports is just not the game and you just do it for your physical building. It's much more. You can build, you can have a strong body and mind as well, and then it's not just limited to that. It can also in like a broader sense, it can also help you have good ties with different countries as well. So it's like a good thing, and that should be promoted in Pakistan as well.
Okay, so it's such a long process. You're gonna, you choose the sport as your career, of course, because I think as the physical therapist, there are not that much, that people as a doctor especially to join in this sport, in terms of sport, because like economically, let's say, the passions, if we compare with the sport passions and the ordinary passions, the numbers is not that high, economically. But if we choose the sport as like, it's my choice, it's different, and also the sport industry is growing up, and I think as the physical therapist, it's not only about the athletes, because people like have the issue with their body, like the what can I say, like injury or something, we can handle that, right?
Yes.
So how is your story with this case?
With this case?
Yeah, because you handle a lot of patients, right?
Yeah. So if I talk about like different cases, about how different people come with different injuries, it's just not like just the athletes coming in with a sprained ankle or something like that, but it's like a lot of other patients in ICUs, and you go for like amputees, and there are just patients with simple surgeries and stuff like that, patients who have like joint pain, like knee simple pain, and things like that. So there are like variety of patients who come in, and you treat a lot of different kind of patients. So it's like different experience in different like categories and different people, and you get to know about them, and you get to know about like what happened and their stories and how, and all of that thing, like all of the stories and all of the things that you hear and you treat, and it makes you learn more and be like there for them.
Okay, I see. Because in reality, so that there are so many cases in real life that because of the lack of the literacy with the physical about the body, because people were participating in many sports, like every sport, like running is easy, right? But if they get injury, they don't know how to handle that injury. So I think as the physiotherapist or the as the sport person, we have to know that we should to educate, right? The people. So I think as the physical therapist is like the generous professions in terms of how to help the people who participate in sport. So do you think, like based on your experience, there are many people that misunderstood about how to handle themselves?
Yes. Especially if we talk about Pakistan. In Pakistan, people tend to go to these like, they have this healers that they have, like not like who are educated or they don't have degrees and stuff like that, but they go to like some we call them haddi jod, like they just crack your bones together and things like that. So they're not chiropractitioners, like not that, but local like people who know how to like fix the bones and things like that. So people tend, because in Pakistan, people tend to go towards that, or even some religious healers. If you have pain, bodily pain or anything, they tend to go there. Let's like have them like treat it and heal it. or homeopathics and things like that. So the thing is like people delay going to a physiotherapist or going to a doctor, which makes the condition worse. If you have a simple sprain or something like that in your ankle and you don't know how to treat it properly, you don't know the right like treatment, like you rest, you ice, things like that, you're going to make it worse eventually. So now I feel like people are becoming more educated about this stuff, and they have stopped going to those kind of healers, and they have like opted more for the doctors, proper professionals. And I think it can really help them minimize the recovery time and help them like improve.
Okay. So we could say, as the physical therapist is agent of change, that for the people, because sport is as the part of the aspects in our life, because it's part of how to, we have to stay healthy, especially for the exercise. And then suddenly some of them, they didn't know how to handle, for example, the injury, the sprain, the strain, and then they just, directly to just, okay, let's massage. But I think there's so many procedures, like, we have heard like the method like Rice, and then Rice method and everything. There's so many literature that explain about the cases in the sport injury. But I think it was a challenge because as a physical therapist, when we handle the patients, like, I think it's gonna be better if they don't like this, but it should be like this. So did you find kind of cases like that?
Not really. Patients, like the patients I have treated mostly come to you for help, and some of the patients delayed. I don't say that they don't come to you like you are the first choice. They go to other healers and things like that first, and they delay, and then they come to you and they're like, they regret doing that because they have this relief of pain like instantly after the treatment, and they're like, why didn't we come here first? Why did we go there? Why did we have to suffer the pain for so many days and things like that?
Okay, so first you should to assess the patient first, right? And then find the why, and then after that, what would you do?
Depending on the patient condition, it's like different for each patient. For us, it's like patient comes in and you go to the diagnosis and you go to the room for diagnosis and you take their history and everything, like what happened, how is the pain, you do some tests and you get to know like this is the major cause of the pain, this is what's happening, it's either like just muscle tightening or like some other thing. So you go for that. Then the patient is sent into the treatment room after the diagnosis, and in treatment room the first basically if the patient has come with pain, if there is no burn or anything on the skin, you go for the heat packs and things like that to relax your muscles in order for you to go further with the treatments, the exercise programs and everything that you're going to do. And after they are done with that, they go to the other treatment room where their prescription is being checked, like what is their history, what happened to them, what is the diagnosis, and according to the diagnosis you do all the exercises, all the things that you plan for them, you give that to them, they do those exercises, they do all the things, stretching or whatever you have planned for them, and after that they are prescribed, they're like advised to do those exercises or do those things back at home twice as well, and they have to come in for at least 5 days to be treated in the hospital, in the clinic, and then after 5 days they can take charge and they can do it, modify it, whatever their condition is up to there, they can do it in their own way, and they can do it up to like whatever time period you have selected for them. You think that is their recovery time, they can do it, and even after that if they have any symptoms, you like tell them that these are the set of exercises that you can do if you have these symptoms and things like that.
Wow, as a doctor physical therapist, a lot of cases that they're responsible to facing the a lot of patients and a lot of issues that which is sometimes specific, And then anyway, can you explain briefly about the main area of like job description with the physical therapist? Because maybe the audience didn't know about the physical therapist. So what's the main area?
Main area, the number one thing that you need to have is a degree, DPT degree, 5 years 5 year undergraduate program.
Okay.
And after that, it's like 6 months of house job. Anywhere internship or house job, whatever you want to call it. And after that, you apply for any hospital that you want. But the thing with Pakistan is that the number of jobs that are available for physiotherapists are very limited. And the thing is like there is more saturation in, if we look at it, in DPT is a 5 year program, but it's not annual intake. They have admissions twice a year. So twice a year, one university is producing almost around 100 plus graduates of physical therapists. I think that is like the same case with any other profession, but because physiotherapists, physical therapy, and things like that are a much newer profession in Pakistan, and these are not like, the jobs are not widely available for them. So there's a lot of like issues in there as well. But if you have the ability and if you have the experience and skills and things like that, you are sure you're going to succeed no matter what. You need to have the practice, and after you are done, we do have like, if we say like practice, we do have the supervised clinical practice during our 5 year program as well. It starts from the 3rd year till the final year. We have the clinical practices. But the thing that you learn after you have graduated, the thing that you learn when you're actually not supervised and you're doing everything on your own and you're like treating your patients and they are your patients and your responsibility, that's where your skills develop and that's where you learn a lot. After that, you basically just look for the jobs and just hope whatever your job is, like you get the advertisement and you get the job. And once you apply for that job, mostly you are going to be called for an interview, and the interview session will be of like 2 parts. It's going to be one, the verbal, the questions that the interviewer is going to ask, but then the second part is going to be the practical side. They're going to give you like scenarios, like let's suppose this is a patient. They will sometimes actually call a patient or their own like worker, and they will be like, let's suppose this is a patient, he came with this issue, now you have to treat it. How will you treat it? Devise a treatment plan. Treat them in front of the HOD or whosoever is taking your interview, and then you do that and you satisfy them with your answer and with your treatment plan and with your like how you're performing all the exercises, that you have the skill, you can function in this environment, you can take care of the patients, and you get the job.
Wow. Wonderful story. Alright, next questions. What's the biggest challenge as the physical therapist so far?
So far. Okay, so I think there are few challenges in Pakistan that I think. Number one is the infrastructure and the resources, because I graduated from Shifa Millet University, which is affiliated with Shifa International Hospital, one of the biggest and well-known hospitals in Pakistan. So I was able to experience the good side of the equipment and the resources and the facilities that are available there. Because we had, like I mentioned before, we had the supervised clinical practices, and the supervised clinical practices were in Shifa. And we were able to go to the rehab center there, to the wards, and see the patients, how everything is done. Shifa, being one of the best hospitals in Pakistan, has the best equipment and things like that. But after my graduation, I also had the opportunity to work in the government sector. One of the biggest government hospitals in Rawalpindi, which is the Holy Family Hospital, and I worked there as a physiotherapist, and I saw a completely opposite picture. In Shifa, you have the best equipment, best resources, best everything. In a government hospital on such a big level where you have more than like 200 patients daily. You don't have any equipment, any resources, any good things there, but you still have to take care of the patients. You still have to go through with your treatment plans, with whatever like equipments you have. And once there was this thing that we were working in the Holy Family Hospital, and there was a round, we call it round, like the head or some senior people were coming to our department to see what facilities or like what equipments we have, how we're treating the patients. So the HOD of our department, he brought a lot of equipments from his personal clinic because they were not available in the hospital, but he had to show that the department is well maintained and they have everything there. He brought those. We didn't even have the infrared lamp. We didn't have the microwave therapy, but like he brought all those equipments just for that day, one day, so that the people come and see that we have everything there. And once they were gone, everything was done. Everything back to his clinic. So yeah, I think that is where we lack the facilities. I think if the facilities, if the funds are properly utilized, because the government hospitals have these funds and everything, if they are properly utilized, we would have the good facilities there as well for the patients who are coming in, because the patients coming in the government hospitals are much more in number than the patients who go to a private best hospital. And then I feel like there is somewhat professional jealousy in Pakistan as well. People, other doctors do not tend to refer patients to physiotherapy, even when they know that the physiotherapy is best option for their patients. They feel like they might lose their patient if they send them to physiotherapists. They will get the treatment, they will like be done with it, they will subside the pain and things like that. So they tend to not refer patients but keep them to themselves and give them medicines and they treat them their own way. Yeah, I think these are two of the biggest challenges. And then lastly, professional recognition. In Pakistan, physiotherapy is somewhat still facing challenges to be recognized. We still are struggling to have our own board, because every other profession has their own board and things like that. We don't have a board, we don't have a committee properly to look over our profession, to look over physical therapy. So we kind of have more issues in getting the more number of jobs to be available and things like that. So yeah, we have this issue with professional recognition as well.
Okay. So do you guys have any physical therapist association in your country?
This is what, like, we do have like small associations or things that people who are working to have the like whole association and an organization who looks after you. But it's like still a struggle because we do have like different education. Like before the DPT was actually introduced in Pakistan, we had BSPT. It was like BS in PT for 4 years. So a lot of our seniors are BSPT, and they're old and they're like well into their jobs, and they know like if we have an association, a proper like organization to look after our like profession in Pakistan, obviously they're going to lose jobs because DPT is going to be a 5-year program, and after that you're going to get the job, you're going to be called a physiotherapist and things like that. So they tend to like not let us come over them. So yeah, professional jealousy and things like that.
Okay, because I was thinking about the physical therapists as the professions. I think it's really important because if we look at the industry, like sport industry or lifestyle industry, you know, people like growing up because people practicing a sport is really high. But if we should to balance with the physical therapist as the as the factor that help people who have it's like sometimes takes injury. We should to help. If this profession is not recognized by the let's say for the country or for the society, I think I'm not sure how it goes, but it's better to balance it, like all the persons who participates, and then especially as physical therapists get into it, and then I think, yeah, there's a chance for you to to taking care of that things as the associations, and then yeah, this takes a long process, right?
Yes.
And do you have any plan for this one?
For now, I'm just going with the flow.
Uh,
Well, let's see. One thing I would like to mention here is like we always think that you need a physiotherapist after you're injured, like you have an injury, you go to them, but like that's not always the case. A physiotherapist can also tell you about the biomechanics and how you can properly do the exercises to actually avoid any injury, to how to do the sport properly in order to avoid any injury. So like we come like there as well, we can help there as well. It's just not after the injury, but before the injury, for injury prevention as well.
Wow, because okay, in my opinion, I think it is mandatory to put the physiotherapist that position in the many areas. For example, in the sport federation organizations, which is there are many athletes, and then health center, because people get injuries sometimes. We don't know the case. Like sometimes it's not only about sport. It's like outside of the sport, people can get injury, of course, right? And then let's spread out the physical therapies over there. So it will be good. It's the part of the help, it's part of the people how to get the physical wellness, right? So yeah, but it's a challenge. Of course, it's a challenge for the physical therapists.
Yeah. And yeah, back in Pakistan, it is a challenge because it's still like we are struggling for the recognition. It's still a new profession. It's still developing. People are struggling to make their mark and things like that. Yeah, it will take time. Every profession, I think, takes time, but we shouldn't stop trying. We should just
of course. I hope that it's getting better, and then maybe you're gonna take a position as the leader or initiator, I think.
You never know.
Yeah.
You never know.
All right. Next topics, is maybe it's outside from the physiotherapist, but I'm so curious to you about nowadays you choose the, let's say, graduate program in sport management. So we are as the same student in the Dream Together Master Global Sport Management program in SMU. So why you choose this program?
Why? I think I believe that not one degree or one profession can define you. I think you have this one life and you need to experience and explore. That's what I'm doing actually. I was a physiotherapist, then I also explored side of teaching as well as a demonstrator, as a clinical supervisor. I explored that side as well. Then I got to know about Dream Together Masters program, and because I was at that time working as with the sports, like people who were coming into the hospital for treatment and things like that, I was listening to the challenges they face. I was listening to what are the issues that they have and things like that, and like how they're not being supported and how they need more like recognition and things. And so I kind of like had like grew interest into this field and while I was like searching about it, I was reading about it, I got to know like how sports manager can do a lot in this scenario and improve the whole sports like overall condition in Pakistan. So I was like, why not give it a try?
Wow. Is it a new thing for you?
Yes.
Oh, really?
Yes, it is new because I wasn't like linked to any sports, like specifically sports side. I didn't have any degree in sports related things. I was a physical therapist. We had the sports physiotherapy. I got to know about like sports and things like that there. But sports management and being a manager and like organizer and things like that, that's a totally different side.
Okay.
The things I'm learning here
Uh,
are not exactly the same as I learned back home.
yeah, because we learn, many things in sport management because it's like broader,
Yeah.
like many things we learn and then from the experiences from the professor. So I think it works for you. I think as the physical therapist and you have the, like future dreams of works that you want to be participate in sport management things, like you want to develop the associations in the Pakistan in terms
Sport
of
industry
sports.
basically
Yeah.
needs to be like more defined,
Mhm.
refurbished,
Uh-huh.
yeah, things
Wow.
like that.
And then what what did you do after let's say you graduate as the sport management master, and then you plan to back to the physiotherapist or something else?
I would try not to go back to physiotherapist, but to stay in the sports management kind of a field and
Okay.
explore this side of the field rather than be a physiotherapist.
Yeah.
I have been a physiotherapist. I
Yeah.
know how it works.
Yeah.
I would still love to go back, but
Yeah.
still, as I'm continuing my master's degree in sports management, I would like to explore this field now.
Yeah. I think uh, after you come back to Pakistan, I think they need you, to help to enhance in the management level. It's different with as the psychotherapist in that field, and then in the management level. So I think if you have like enough capabilities into that, so you can help the profession, your friends over there, to I think to of course to engage to leveling up the physical therapists in your country, right? I hope it's getting brighter.
I hope so too.
All right, last questions, Kiran Fatima. Do you have any like message or suggestion about the women empowerment in sport?
Women empowerment in sports. I know women in sports have to go through a lot of things. They have to strive harder, they have to work double than the men. But I would just like to say that you are doing your best. You are the best. You can do whatever you think you can do, no matter what others say. Don't believe them and just do your best and enjoy the ride.
All right, that's fantastic. Yeah, guys, this is Fatima. Yeah, she already tells about the stories as the physical therapist, and then now she participated in this sport management program. So Fatima, wish you all the best, all the success for you,
Thank
all
you
your
so
career, all your
much.
journey. And then that's it. Thank you very much for your attention, and see you later.